A recent spike in hospitalizations from COVID-19 raises new concerns about the risk of infection during the holidays.
Yeah, here to answer your questions is Dr. Sharon Wright, Chief Infection Prevention Officer at Beth Israel Lahey Health. Dr. Wright, thanks for your time tonight.
Thanks for having me.
Dr. Wright, we have seen these numbers surge since mid-November. What is causing it?
It's really due to a combination of factors. We still don't have a fully vaccinated population, even though most people who are eligible have been vaccinated. The weather's getting colder, the holidays have been coming, and people are gathering together, oftentimes unmasked. And we have some waning immunity likely with the need for booster vaccinations. But keep in mind that some of these reported new infections are mildly symptomatic, and not all are symptomatic, though many of them are. And we need to remember that it's layering of interventions that are really important. We're all really tired as the pandemic wears on, but we do know what to do. So we need to get vaccinated or boosted if we haven't already, wear our masks when indoors with people outside of our household bubble or with people who are at high risk, or when you don't know everyone's vaccination status, and maintain physical distancing when unmasked. And now we know to get tested, even if you have only one symptom, no matter how mild, or if you think you've been exposed.
Well, Dr. Wright, as you know, the Omicron variant is causing some serious problems, starting to cause serious problems in the UK and a couple of other countries right now. It looks here in the last couple of days that our cases are not rising as quickly. At least perhaps that's Delta, though. But do you expect that to change? Will we see more cases here in New England and in the U.S. as Omicron kind of takes hold?
I think that we can count on a growing number of cases of Omicron in the U.S., and they're probably here already. Since sequencing is really needed to definitively diagnose Omicron, and not all of our PCR tests can detect the S gene dropout that might suggest the presence of Omicron variant, I think we're probably undercounting. And if we use other countries like the UK and South Africa as examples, I think we will continue to see more in the coming weeks.
And we know it's still early and you're still waiting for more data about Omicron, but does it look like it could outcompete Delta and become the dominant variant?
Based on what we're seeing, I think we should anticipate that it will become the dominant variant in a week or two. It's important to remember, though, that we already had rising COVID numbers before Omicron started, due mainly to Delta, and that's still mostly what we're seeing now. And so the prevention measures that I mentioned, vaccination, masking, physical distancing, and testing, are really critical either way.
So we've heard from a lot of viewers that they're having trouble booking an appointment for a booster shot. It pretty much looks like you can't get a booster appointment just about anywhere in Massachusetts right now. Are you concerned that some people may just give up? And what is the risk if they do?
I mean, I think Massachusetts has one of the highest vaccination rates in the nation. And so we all know how important vaccination is in the prevention of severe complications of COVID and hospitalization due to COVID-19. We dealt with this early on in the pandemic. So we know it's important to just really stick with it. It's unfortunate that there are waits now that everyone can get boosters, but there will be enough vaccine. And we just have to book an appointment as soon as we can. And remember that the more virus that's circulating, the more likely we are to see additional variants in the future. So it's really important to get that vaccination when you can get it scheduled.
All right, Dr. Sharon Wright, Beth Israel Lahey Health, thank you so much for your time and information.
Thank you.
Thank you.